face me sideways. Okay, good. Your body be close to the table, good. Okay, get some chest first, good. Grab it.
I never remember how that goes.
Oh no, it's okay. Yeah, good. Okay, stay. Oh, a little bit tight.
Yeah. The hips are always tight.
Always tight.
Always tight.
Okay.
Always.
Good. Get some chest first. This hand. Good. Okay. Good. Oh, this side's better. This side's better. Yeah, really good. Okay, screw side up.
Okay.
And then your hair move up. Yeah. Okay. Move up. Like whole body move up a little bit. Okay. Good. Okay. Perfect. Yeah. Stay here.
And we're going up.
Yes. Yeah. Okay. Good. Make sure you relax your shoulder. Okay. Good.
Okay. That's the key. My shoulders are always up next to my ears.
Okay. So relax your shoulder. Okay. Oh, nice. Wow. Oh, this is really good. Okay. Okay. So yeah, make sure you relax your shoulder. Okay. Good. Nice. Wow.
Oh my gosh.
Okay.
The relief.
Okay. And then slide down a little bit, like a little bit more until okay, good, perfect, yes. Okay, yeah, raise up your head a little bit. Okay, your hair gets okay. Let me make sure both sides. Okay, good. Relax. Oh, nice. Oh, it moved. Yeah, perfect. Okay. So, like your leg move, right? I feel it too. So, when you get up, turn your body sideways, right? Sideways, using elbow hand push yourself up is easier. So when I try to decompress your spine, like because last time you saw X-ray, this decrease.
I felt it. Yeah.
Okay. So when I try to decompress your spine, so sit all the way back. Okay. Be careful. It's metal here. Your hand do this under the hair.
Yeah.
Okay. Good. Oh, like under the hair is easier. Yes.
Okay.
Okay. No, don't worry. Okay. So keep some space and then relax a little bit. Okay. Okay. Good. Yeah. Make sure we just relax. Okay. Okay. A little bit. Okay. Oh, the whole spine move. Oh, that's good.
I feel like it's released. Like there's been the pressure release.
Oh, yeah. Your neck move a lot. Oh, that's good. It's really good.
Yes.
Yeah. Both sides.
Yeah. Okay. I feel better.
You feel better?
Well, because I just felt so much compression. Because I think it's because I end up on my side when I wake up, and like I'm always like this.
Oh wow.
So I feel like everything just compressed down.
Okay.
Okay.
Okay. Good. Okay. Thank you for
so
coming.
much.
Thank you.